I think this man needs a new brain.
Excuse me, doctor.
What are you doing here? This is a sterile room. Sort of. I'm going to perform surgery on this dead guy in like 2 minutes. Get out.
Oh, I'm sorry. But I was looking for my walker. I need it for support.
What do you mean you lost your walker? Never mind. It's not safe for you to out without your walker.
Oh, I'm fine. My double hip replacement fixed everything. It's my poor vision and muscle weakness you have to watch out for.
Each year, 1 in every 3 adults age 65 and older falls. Falls can cause moderate to severe injuries, such as hip fractures and head injuries, and can increase the risk of early death. Fortunately, falls are a public health problem that is largely preventable.
That's interesting. Tell me more, handsome.
In 2010, 2.3 million non-fatal fall injuries among older adults were treated in emergency departments, and more than 662,000 of these patients were hospitalized.
Wow, that's like $30 billion in medical costs just because of falls.
Wow, how did you know that? You must be really good at math or something. Well, 20 to 30% of people who fall suffer moderate to severe injuries such as lacerations, hip fractures, or head traumas. These injuries can make it hard to get around or live independently, and increase the risk of early death. Many people who fall, even if they are not injured, develop a fear of falling. This fear may cause them to limit their activities, which leads to reduced mobility and loss of physical fitness, and in turn increases their actual risk of falling.
So what you're saying is I should be more careful?
Yes. Previous fall, previous poor mental state, unsafe mobility, visual impairment, incontinence, medications, home hazards, chronic conditions, general wellness, are all factors that play into falling.
What should I do to help prevent falls?
I'm glad you asked. Do not walk and talk at the same time. Concentrate on walking and continue conversation when you get to a safe place. Quiet, don't interrupt. Now wear appropriate footwear. When walking long distance and in unfamiliar places, wear flat, non-slip shoes. Also, wear shoes that fit well and are comfortable.
But I like wearing high heels when I vacuum and do laundry.
That's awesome, but you should be careful, you're no spring chicken. You should also arrange furniture in a way that creates plenty of room to walk around. If using a walking aid, make sure doorways and hallways are large enough to get through with any device you may use. Install railings in hallways and grab bar and bathroom and shower to prevent slipping. Make sure you have adequate lighting in the house. Install non-slip strips or rubber mats on the floor of tub and shower. Remove throw rugs or secure them firmly to the floor. Use caution when carrying items while walking. Use a nightlight when getting out of bed at night.
I'll get my husband Henry to do all that.
Good. You should also stay active to maintain overall strength and endurance. Exercise regularly.
I do squats and arm exercises at home all the time.
Wow, that's impressive for a woman that needs a walker.
I also enjoy dancing like a robot.
Stop that. Don't ever do that again. It is important that the exercises focus on increasing leg strength and improving balance, and that they get more challenging over time. Tai Chi programs are especially good. Get your doctor or pharmacist to review your medicines, both prescription and over-the-counter, to identify medicines that may cause side effects or interactions such as dizziness or drowsiness.
When I take my medications all at once, my cat talks me.
Ha ha, you're crazy, but I like you. You should be more careful with your medication. The more medications you take, the more likely you are to fall. People who take 4 or more prescription drugs have a greater risk of falling than do people who take fewer drugs. Do not change your medications on your own.
I do feel dizzy sometimes when I get up too quickly.
Blood pressure that drops too much when you get up from lying down or sitting can increase your chance of falling. This condition is called postural hypotension, might result from dehydration or certain medications. So be sure to change positions slowly and dangle your legs when getting out of bed.
Well, thank you, are very informative. You should become like a doctor or something.
You're welcome. Now get out.